everyone, and welcome to the Center for Health Equity panel on social determinants of health and how that impacts our student learning. We're very excited to have a wonderful team of panelists here, and I will go ahead and let them introduce themselves. Dr. Uday?
Yes, good evening. My name is Regina Uday, and I've been with the Department of Health and Human Ecology since 2011, and thank you for inviting me to this panel.
Hello, my name is Salome Mshigeni. I'm an assistant professor in the Department of Health Science and Human Ecology, also the MPH program director since fall of 2018, and I'm excited to be here. Thank you.
Hi, I'm Dr. Jacqueline Romano. I'm in the Department of Teacher Education and Foundations, and I'm in charge of the English language learners for single and multiple subject credential programs.
Thank you all, and I would also like to introduce our wonderful TRC intern and project manager, Kelsey Schreiner.
Hello, my name is Kelsey Schreiner. I will be graduating this May with my bachelor's in health science with a concentration in public health, and in the future I'd like to continue my education to become an educator and then move on to become an instructor.
Thank you, Kelsey, and I'm Moni Becerra, the interim director for TRC and the immediate past director for the Center for Health Equity. Now, we're very excited for our panelists, and Dr. Uday has a wonderful presentation on discussing what are social determinants of health before we jump into a further discussion. Dr. Uday?
Thank you. Thank you, Dr. Becerra and fellow panelists for inviting me to participate in this timely discussion regarding social determinants of health. So to begin, what are social determinants of health? Social determinants of health are the conditions in the environment in which we are born, live, learn, work, play, worship, and age, as well as the wider set of forces and systems that shape the conditions of daily life. In addition, race, gender, sexual identification, education, socioeconomic status may also have a profound effect on the range of health, productivity, the quality of life, outcomes, and exposure to risks experienced by many individuals. Social determinants of health also influence the opportunities that are available to us as individuals that allow us to actively engage in healthy behaviors. In many cases, these opportunities may enhance and/or limit our ability to live healthy, productive lives. So what are some examples of social determinants? These may include the availability of resources to meet daily needs, such as safe housing and access to local food markets, access to quality education, economics and job opportunities, access to healthcare services, as well as the availability of community-based resources that support healthy community living. In addition to that, access to transportation, public safety, and social support should also be considered when we're talking about social determinants of health, as well as social norms and attitudes regarding discrimination, racism, and in many cases, distrust in our own government. Included in these determinants are exposure to crime, violence, and social disorders, as well as language barriers, culture, and education, to name a few. Social determinants of health are also closely linked with health outcomes. Researchers suggest that the number of deaths in the United States due to social factors such as lack of education, racial segregation, discrimination, and poverty may be comparable to the number of deaths from heart disease, lung cancer, and other chronic diseases. Social determinants of health can influence and contribute to chronic health conditions such as obesity, diabetes, and heart failure. For example, for someone living in an area where there's considered to be a food desert, where they lack access to healthy foods, this may be an attributing factor to higher rates of obesity. Social determinants of health also contributes to health disparities. These disparities can occur when people are disadvantaged as a result of personal circumstances, such as their race, their socioeconomic status, or geographical location. As many of you know, where a person lives may be an indication of how healthy they are. This in part may be due to access to healthcare as a result of providers being available to them, geographic barriers, limited transportation infrastructure, as well as lower education attainment. Addressing the factors of social determinants of health and their root causes play an important role in our ability to understand the impact these conditions may play on the health and the well-being of the population.
Thank you, Dr. Uday, for such a wonderful foundational information on what are social determinants of health. It definitely helps all of us as well as our audience when they view this as to what are SODH and why they're so important. So I have some questions for the panel, and Dr. Michigani, if you may start with the responses. There have been a lot of discussion that education is a major social determinant of health, and we heard Dr. Uday also mention that. Can you discuss a bit more on why education is considered to be a social determinant of health?
Thank you. So, when one achieves more education in comparison to another individual, those who have more education, they're more likely to get better jobs, afford better housing in good neighborhoods where the zip code does not impact their health outcomes, and also have access to medical care through their employer's health insurance coverage. And those with less education, experience the opposite. They may not have access to care due to lack of health insurance coverage because they're working part time. They may not be able to afford better housing in good zip code, and also they may not be able to have a better job in comparisons to those who went to school. And that's why education does contribute to either bridge the gap between those who have and those who do not have much, the haves and the have nots. And that's why education is one of the key indicators of social determinants of health. And I usually tell my students that the more education you have, the more you are increasing not only your life expectancy, but your chances of getting a better job, your chances of having health insurance coverage, and your chance of better housing environment.
Thank you, Dr. Michigani. Dr. Uday, did you want to add something to this?
Yes, absolutely. Thank you. In addition to that, education shapes our lives. It is the key to lifting people up out of poverty and reducing socioeconomic inequalities. Education can affect us throughout our lifetimes. It has been found through various studies that having education beyond high school can increase income by 11%. Also, education is linked to healthy lifestyle behaviors as well. We see that when it comes to tobacco usage, it has been found that those that have less of a high school education are more likely to engage in behaviors that are not as healthy for their overall health outcomes. And so we see that based on that, along with the ability to earn more based on education, the ability to live in better neighborhoods, to live in an area where we're more or less likely to be confronted with crimes and conditions that are not safe, we found that education put us in a greater opportunity to achieve those areas where we are feeling able to obtain more and therefore engage in activities that are more better for our health outcomes. In fact, education influences our health in an overall throughout our lifetimes. Our level of education attainment also have a direct link to the importance of our health due to the type of health outcomes and health access that we have to various different types of medical care. And of course, that would increase our life expectancy as well.
Thank you, Dr. Uday. Dr. Romano, would you like to add to this?
Well, my colleagues have explained very well what is the relationship of education and the impact in our lives. But I just want to echo and reassure. Yes, education is a major determinant of health. And I see it from the perspective that individuals who have access to high quality education have a better opportunity in life in all aspects, socially, mentally, physically, and even within the reach, they have opportunities that before couldn't have, right? So looking at from the education perspective and literacy, having access to education and be able to read and write and able to gain more knowledge as students or future individuals that have that knowledge, you can make better and more educated decisions about their health, about their lifestyles, and also share their knowledge with others and communicate about their health, their opportunities for a better life or for improvement. Um, in this country, in the United States, is mandatory that students complete high school in order to have a job. But in another parts of the world, maybe high school is not the last level for education and can be as early as elementary when this the last level. So that will create an equity and a gap in knowledge and literacy and access to resources that can benefit and help the health of an individual through their life. So it's important that yes, education is a major player in our health. The more than you know, the better decisions you can make and the better opportunities you have for you and your family in the future.
Thank you all for your wonderful and informative responses.
Okay, I'm going to start with the second question, and Dr. Romano, I'm gonna let you go ahead and take over first. So, our students come from various backgrounds, such as different cultures, racial, ethnic backgrounds, gender identity, and bring unique experiences to the classroom. How do all of these shape their learning?
Yeah, thank you, Kelsey. I want to say that learning is a process. All humans, they have that capacity to learn. We all learn in different ways. What we know, how we share what we know is shaped by our culture, our language, and the background, ethnicity, and our perception of the world, right? Our cosmovision of the world. So what I look into the social determinants and education access to qualified teachers or a high level of education is important because the teachers who know how to educate or share knowledge through these different perspectives and lenses have more access with the students. So we're looking at having access to education, into knowledge, into literacy development based on cultural relevant pedagogy, having an understanding that all humans are unique and we all learn in a different way and we share what we know in different ways. And teachers having that knowledge provide opportunities to all of them to share what they know, not limiting or putting aside some students and favoring others. And in that, I want to rephrase the question. So it's not how they shape our learning, because we know that our culture make us who we are and how we behave in society, but how is this affects the social aspects of our life and how our cultural also beliefs and values determine what choices do we make that creates a better healthy life. So teachers need to understand these differences and from that perspective helping students get more knowledge and more access so they can become fully literate and have better opportunities for the future.
Thank you for your response. Dr. Uday, did you want to add to this?
I believe that a student's background helps to shape their learning experience through the environment where they live, work, and play. Many of our students are first generation, and in some cases, many of them may be even undocumented as well. And based on their unique experiences, this may limit their access to education through affordability, the stress and anxiety, and even the fear. Many of our students work to support their households, and many may even struggle with a language barrier, being that English may not be their first language, as well as safe environments to study. I had one student to share with me that when COVID-19 hit, we were forced to close down. She said that she struggled greatly because she lost her safe zone. So many times students may be in hostile climate as well as inside and outside within their educational environment, and that can take a toll on students. In some cases, students may be living in households with mixed statuses, such as households where that student may be a citizen, but their family members may not. And so that fear of that family member being taken away, them having to take over the responsibilities of handling the overall household expenditures, in addition to that, trying to study and educate themselves for a better opportunity can also take a toll on that student's ability to be effective in the classroom. I know that during the last 12 months, since we were forced to engage in activity outside of the campus itself, several of my students had to drive down to campus or to other places where there were access to Wi-Fi just to have access to do their class assignments. And so I think that when we start to look at the struggles and the barriers that some of our students have based on their backgrounds and the environment that they come from, is something that we should keep in mind. Also keep it in mind that many of these students come from multi-generation households, meaning that it may be a challenge for them as well to find a quiet place for them to actually engage in educational activity as well. I had another sister to share with me that she wanted to be called by what she self-identified with versus than what it said on the class roster. And I think as faculty members, we need to also consider that as well, that we show that respect for those students and make the classroom as comfortable so that they can engage in learning opportunities without fear of struggle within their learning environment.
Thank you so much, Dr. Ude. Can we go ahead and move on to you, Dr. Mishkini?
Absolutely, but my colleagues have summarized it all. I would like to emphasize the same pointers. The majority of our students are first generation college students, so they may not have the full support at home as far as what academics involved and what that entails. Many of them are Pell Grant recipients. Many of them work to support their families. And as a result, they may have a lot of financial stress and family obligations to fulfill that may negatively affect their learning performance, meaning they may end up with low GPAs or lack of equipment, to name a few. We all experience lack of equipment or Wi-Fi, things that we all take for granted many times. And overall financial stress. They're not just thinking of passing their classes, they're also thinking about, how am I going to pay the next bill? How am I going to fill up the fridge so everybody else in the house is satisfied? So those are the challenges that our students are facing, and all these circumstances will actually do shape how they do experience their learning while in college. Thank you.
Thank you, everyone. And as we go towards the end of our panel, as a final word, what would you want our audience to know about social determinants of health, and especially how it relates to student success? Dr. Ude, if I may start with you.
Absolutely, thank you. Education, as we discussed earlier, is a key social determinant of health. As it was said before, it shapes our lives as well as the lives of our students, our ability to obtain better health, certain statuses within life, as well as access to healthcare. Education aids in lifting people out of poverty and improving their overall social economic status. As we discussed, education is one of the leading driving forces in eliminating many of the social determinants of health that we discussed. On a daily basis, in many cases, a sound education provides an opportunity for our students to gain better access to healthcare, safe living environments, healthier food options, thus allowing them to make better decisions when it comes to their overall health. I believe that we as educators need to work as hard as we can to ensure that the learning never stops. I believe that we as educator actors must also continually strive to widen the understanding that we need to make sure that the materials that we provide for our students in the learning opportunities are inclusive, that they are at a level that will make all students feel that they're capable of completing the work. And as long as we remember that it is our responsibility to make sure that all students, no matter what background they come from, no matter what they identify themselves as, it is our responsibility to make sure that we provide them with the most effective tools to be successful in society as they leave Cal State. Thank you.
Thank you for those wonderful last words, Dr. Romano, and then Dr. Michigani, if you may please add your last words as well.
Thank you, Dr. Becerra. Thinking about the last question, I'm looking, it reminds me of Maslow's hierarchy of needs. During this time, we need to cover the basic needs of our students in order for them to be successful in class. So if we are trying to help our students and expect them to be successful, we need to allow them to share what they know in the best way they know, be cultural, linguistic, different approaches of learning and showing knowledge, and supported in a different ways and provided experience in our classes that are supportive in all aspects, sometimes emotionally as well, be a mentor, be it a listener, be a guide, sometimes even a friend. And if our students will do better if they feel that they feel care, love, and understood within our classes. I think that's what the main words that I will provide is we need to provide what they need during this time to our best of our abilities, because we are also human beings that are going through challenges, but making sure that our students are fully supported in the best way we can so they can graduate and continue with a full life ahead of them in the best healthy way, and sharing with the rest about their knowledge and what they're able to do.
Thank you. Just to add a little bit to that, in closing, I would say we need to keep our ears and eyes open so we do not miss any red flags. So we identify the obstacles that our students are experiencing on a day-to-day life. This will help them become successful as they're pursuing their academics at Cal State San Bernardino. We need to meet them halfway. We need to help them succeed in their careers beyond the classroom. We need to do a little bit extra, be the mentor, the coach, the person that will encourage them to believe in themselves, that they can go from undergrad to master's level and everything will be okay. Because as we all understand, education does play a major role in improving one's not only health outcome, but just life style in general. And therefore, keeping our ears and eyes open will help us go far. Thank you.
Thank you all for your wonderful thoughts. I'm sure our audience will be delighted to hear your examples of social determinants of health and how they're tied to learning process and student success. I also want to thank our wonderful intern and project manager, Kelsey, for being here and her supportive role, as well as our co-directors for the Center for Health Equity, Dr. Paul Crisopala and Dr. Benjamin Becerra, who are always very supportive of these initiatives. collaborative initiative especially, and of course the entire Faculty Affairs and Development team, Dr. Viviana Diaz, FCE Executive Director, AVP Ilderim, for all their support and making these collaborations happen. Thank you, everyone.